you both.
Likewise.
You enjoying the weather?
Could be better.
The good side, people are staying in here, so that's good.
Yeah.
Yes.
Well, I mean, it's just like prolonged cryos. Instead of 2 minutes, you just
Yep.
go outside, stay there for an hour, and it's like 2 minutes of cryo, slow and agonizing instead.
And wind therapy.
And wind therapy as well, yes.
Yeah, that is indeed what it is. So, I mean, we obviously got a nice intro to you both already, but I do want you, especially Anders, because Umahro, you are like the rock star in Denmark, so everybody knows you. Who here doesn't know Umahro? Only a few. Okay, we'll let him. He will definitely shine a light later. But Anders, I know you and I met not so long ago,
Yep.
and for me, you were kind of like what do you call it? You know, an undescribed chapter in my life anyway, and certainly I think you've been hiding somewhere. And you're an amazing doctor, I've come to realize. So tell us a little bit more about your background. You're very, young? 32, 30?
Yeah. 33. Yeah.
And you have an amazing setup already. And I want to understand a little bit more about what kind of led you into working so much with males in particular.
Okay. So it basically started all the way back in medical school. So most people know that medical school is a very challenging environment. There's a lot you have to study, and you want to basically do it all. And part of that is also, you want to party, you want to be social, and you need to study a lot. Yeah. And in that environment, if you're not really having an optimized kind of balanced lifestyle, then you can sometimes have a crash. And during medical school, I had my own kind of experience with that. And that was really challenging because I had to figure out a way to kind of heal myself. And it started out as kind of like chronic fatigue issues. And that put me down a path of functional medicine, diving deep into the literature. And unfortunately, I think many people have probably experienced that if you go to a general physician, they might, chalk all of your problems up to just, stress and, maybe you're depressed, maybe you need an antidepressant. And in my experience, that's not the full picture.
Right.
So that took me down a path of really discovering this holistic world of medicine. And in that chapter, I realized that hormones are incredibly powerful.
Right.
And they are these signaling molecules that basically have an effect on every single part of your body. And in particular, for males, they are like the lifeblood. And we're going to talk about that surely, but there are many things that regulate how testosterone isn't just produced, but also expressed and used by the body.
And before we go there, tell us the work that you actually done at the hospital with regards to this.
Yeah, so I've worked at two of the largest hospitals in Denmark. So one is Odense University Hospital, and the other one is Rigshospitalet here in central Copenhagen at something called the andrology department.
Cool.
And there we really look at both infertile men, but also men with low testosterone. And to really
sick men, men who doesn't feel well. Okay.
Yes, these are really ill men. They're usually referred from their general physician, from their family physician that refers them to us. And then we have to do a lot of diagnostics, and we can get into that. But that was my experience working there. So working with some of the leaders in the traditional system, and we can talk more about that.
Awesome. Thank you for giving that background, and thank you for looking in this direction. And those of you who know me, being so passionate about this Health Week setup here and everything that's got to do with preventive medicine.
Yes.
I'm so glad you, as a doctor, in looking in that direction. And Umahro, as we go way back, and as I joked with, everybody knows you here, but maybe, I want to throw this first question over to you, right? And I wanted this conversation not just to be about testosterone, because it's so easy to jump to that when you talk about male health, but I would like you to just give me, if you can, your kind of top 3 or whatever, 1, 2, 3 misconceptions about male health. Like, what are we missing?
Yep. Okay. Well, one of the things missing is that it's all about testosterone.
Yeah.
Like, that's a misconception, because I mean, the funny thing, if you get into the nitty-gritty, men actually also need estrogen. So
100%.
So, and I've had cases of men who actually, because they were tinkering with testosterone, ended up with too low estrogen, and then they had menopause-like symptoms.
Yes.
They had hot flashes, they
Yes.
had dry eyes, wrinkly
Wow.
skin, and joint pain. So although just testosterone is super important main male hormone, that is just about, when it comes to hormone male, it's just about testosterone.
Yeah.
I think, and then the other thing is that it's always about the amount of testosterone. As you said, it's as much
100%.
about signaling response effect as it is just like higher testosterone, better, But as long as it's not low, that's not really the most important.
That's the first misconception. It's not just testosterone.
No,
Right.
exactly. So I think
What else could it be?
well, I mean, another thing I think for men is men don't need vegetables. Like, I'm not going to eat that rabbit food, in which I say, yeah, vegetables are rabbit food, but don't say it condescendingly, because, what do we ascribe to rabbits apart from big teeth, good hearing, good sight? Well, energy and libido. So you want your rabbit power? Man, you better eat your vegetables.
True.
I mean, if you say in Danish, right,
It's a very good point.
6 servings a day, and in Danish, 6 is sex, so it sounds the same. So yeah,
Nice.
if you want sex, you need at least 6 or more.
Think like a rabbit.
Yeah, exactly. So I mean, I think that's, and then it's like, I don't need sleep.
Right.
I can sleep when I grow old. Sure, you can, but you're going to grow old really, really fast. And I mean, some of the things that will really tank testosterone is just persistent sleep deficiency or sleep insufficiency, poor sleep.
Yeah.
I mean, those are like a couple of things that, and then of course, just eat meat and saturated fat, and you get like the highest testosterone ever and be like Superman, maybe for a short while before you die from cancer or cardiovascular disease.
Yeah. Good list, Umahro. Thanks for that. What about you, Anders? What could you add to that?
I think it's really good points. I would like to jump into the one on total testosterone. So testosterone is transported in our blood through some carrier proteins. One of them is known as sex hormone binding globulin, and another one is albumin, which is like egg white. And part of the testosterone circulating in your bloodstream is free, but it's a very, very minuscule amount. So when we talk about testosterone, and you might hear someone say, like, I have 24 nanomoles per liter of total testosterone, or they're just going to say testosterone. That doesn't actually tell you what is the free amount of testosterone.
Right.
And it's the free amount of testosterone that is key for it to actually be biologically available and usable by your body. And then when we get into the nitty-gritty of that, then you also have how do you respond to that testosterone.
Yeah.
And that is a long discussion because we get into genetics and how
Maybe we park that
specific-
for the later question, but so that's a good point. It's just to kind of summarize here, you're saying it's not just about total T, it's also free T, right? So introducing some interesting nomenclature here. So what other things may be a misconception?
Yeah, so I would say, again, testosterone is only one part of the male health picture. So you need to look holistically. So you need to look at the thyroid, you need to look at the liver, you need to look at kidneys, you need to look at the balance between testosterone and estrogen. If you want to get really advanced, you actually need to look at testosterone, its derivative DHT, which is called dihydrotestosterone, which is 4 to 10 times more strong as an androgen than testosterone. And of course, you need to look at the relationships between these.
Yeah.
So it's not just testosterone. It's actually an interplay of many different hormones that are all synchronizing a specific response in your system. And if you're going to a certain place and you're just, someone just looks at your testosterone and they're just like, here's some testosterone, that might not move the needle at all for you because maybe the issue was with your liver, or maybe the issue was with your estrogen being incredibly high.
Yeah.
So, that's one point.
Any other points you want to mention? What are we missing, us men? Because, I mean, we all just told we just need to lift weights, right? And to your point, Umahro, we need to sleep better, we need to stress less.
Well, that's it. Stress. I mean, that's the other thing. Like, man, just go on. I'm just going to be strong and
plow through.
Plow through. But because another thing that will tank your testosterone as a man is chronic persistent stress. Yeah. So some of these things that are sometimes considered a bit soft, sleep, stress, and you could even say like there are 3 as a sleep, stress, and social relations because they also affect your mood. Yeah. I mean, they're really important, but so physicians say, no, not really important for man. I'm Superman made out of a mixture of granite and titanium, stainless steel.
So maybe, Umahro, I'll ask you to clarify this point, and I love this HPG axis.
Yeah.
So unpack that for the audience.
Yeah, so HPG axis is your hypothalamus, pituitary, gonadal axis, right? So deep in your brain, you have what's called the hypothalamus. Think of it as this old, ancient part of your brain that looks at everything. It looks at hormones, it looks at immune messages, it looks at your mood, it looks at energy levels. And then it has to really change not only how you think and feel, but also it controls all your hormones. And then it will talk to the pituitary, in Danish, hypophysen. And think of the pituitary almost like the field general that's, we have the central command and then the field general that will direct all these hormonal systems. And then the pituitary will speak to your gonads, for us guys, testicles, you women, it's going to be your ovaries, and start controlling what's happening. So what happens is when you look at stress, if you look at people who are traumatized, not getting enough sleep, all these things we tend to consider a bit soft, that they're more like feeling, not biochemical. Well, if your hypothalamus is constantly like, oh, this is a dangerous situation, we're in a deep shit state of alert, eventually that's going to impact the messaging all the way down to your gonads, and it will actually eventually suppress or lower your testosterone production. Partially probably because like an evolutionary response saying, well, you're in a really unsafe environment, procreation not the best idea right now because the risk of investing all that time, energy, resources when it's a dangerous environment, let's just shut that down.
Yeah.
Yeah, and so that axis can be interfered with. And of course it also, because it perceives not just stress, but it also perceives other hormones. So if other hormones out of sync, that could be affected. It perceives energy levels. So if you have massive obesity, which will also interfere with testosterone in other ways, that's also going to be a trouble. If you have chronic inflammation, so anything that sort of comes to your hypothalamus and constantly looks like danger, fear, unsafe, you have to be on the lookout constantly. Eventually it's going to tank several of your hormonal axes, including literally from these old centers of your brain all the way down to your testicles.
So in summary, the HPG axis controls our ability to make testosterone, and stress is a huge factor of impacting that, and obviously sleep and the other things we've talked about. But so I want to throw it over to you, Anders, because I had a patient in my clinic recently, a young guy, 30 years old, stressed, a lot of gut issues, and clearly a strong young man, yet he had very low testosterone. And I know in your work at the hospital, you saw a lot of people like that, but give me some facts if you have them in terms of how many men in their 30s actually are running around with kind of clinical levels of what's optimal from a testosterone perspective.
I think we don't really know, to be perfectly honest. I don't think we know how many men in their 30s walk around with a suboptimal or low testosterone level, because we just don't hear about it. Because a 30-year-old, if they would go to their doctor and ask about testosterone, you would be laughed at, because if you're 30, you should be pretty good, right?
And what are some of the symptoms that young men maybe should look, not to scare you off, audience here, in terms of that, but just what should you look out for?
In your 30s, 40s, and 50s, and even 60s, depending on the decline, things like low libido. This is, so low sex drive is one of the clear signs. Not having a morning erection is a very, very clear sign.
Easy to measure.
Very easy to measure. You shouldn't be in doubt.
Nope.
And of course, I would say testosterone is a very interesting hormone because it facilitates dopamine transmission in the brain. And dopamine is one of those neurotransmitters that increases the saliency of any task that you want to do.
Right.
So if you're very interested in certain things, and you suddenly lose your interest in the things that used to, get you interested, then that can be a clear sign of testosterone deficiency. And that's that kind of drive, the male forward-driven experience. And I would say that's one of the things that is usually kind of misdiagnosed, because if you, as a 40 or 50 or 60-year-old man, you go to your family physician and you tell him about this experience, the first thing he's going to think is that you're depressed because you're now apathetic. You don't feel the same joy of spending time with your kids or, going for a run. Nothing really drives you anymore.
Right.
And that is an incredibly important point, because if that physician doesn't know about the interplay of hormonal health, he's just going to say, this is clearly depression and treat you for that. But that's not the root.
So playing devil's advocate here,
Yeah.
Umahro, I mean, we've often been told just train more.
Yeah.
In that scenario
Yeah, yeah.
there, what would that be? I mean, how would the body react to that?
Well, I mean, it depends a bit on the state of the man in the first place. I mean,
Right.
you could have low testosterone, he's really out of shape, he's obese,
Yeah.
you know. So in that case, training would probably help. But if that's not the case, so he's not overweight, he's in decent shape, training hard would actually be counterproductive because he
Yeah.
won't respond, he won't recover. And
Right.
that's the other thing I'd say. What I've seen in the clinic, men who have low testosterone, I've seen a couple of men who the libido is actually okay. They didn't have erectile dysfunction. They might have noticed, okay, I'm not going to go for 5 hours any longer. I'll just go for half an hour. But then I've had 3 cases this year who all they wouldn't respond to exercise. They're like, I lift weights, I program,
Yeah.
I take creatine, I get enough protein, but like I just don't get anywhere. Or the moment I try pushing things, then I get these overuse injuries. And then when we went and tested, and all of them, they had low free testosterone, so it wasn't their total testosterone. So some of them were tested initially. And it's like, well, your total testosterone is fine, but then they had really high sex hormone binding globulin, which got them in trouble. So that would be another one that just like you don't respond to training, or you can't recover from training. You get overuse injuries, or you do a CrossFit event, run a marathon, half marathon, whatever, and like 3 months later, you're still, your joints still aren't recovered. That, you know, that could be.
Exercise intolerance is a big one.
Yeah.
That's for sure. If you're sore like a week after you do exercise and you're usually exercising, that's a clear sign that something is going wrong in the anabolic environment in your body.
So fascinating. I mean, I could talk for days with you guys about this, and sometimes we do. But let's shift gears a little bit. And we've kind of covered a lot of ground already about hormones other than testosterone. But let's take a little bit of a dive into estrogen, and just let's unpack for the audience here why, if that you think that is the case, that being meticulous with your hormones is not just something for females, as we've been told for many years. And I think you read a lot in the press about how andropause is not really a thing. And maybe start with you, Anders, obviously going back to your medical profession there. Why is it that we don't recognize andropause or male hormonal issues?
Yeah. So I think this is a very complex issue because the rate of change over time for an individual man is different.
Yeah.
So some people are blessed with very good testicles, very good testicular health. And that means
what
that...
size should they be?
They should be...
I know, you showed me something the other day that made me laugh.
Well, it should be that it's not comfortable to sit like that. You have to...
I'll open this up for you. I was with Anders the other day and he showed me some new, I'm not going to call them toys.
Orchidometer, yeah.
What do you call them?
Orchidometer.
That's meant as a doctor to measure the size of testicles.
Yes.
Yeah.
Okay. So the point I was trying to make is that you can have someone with really good testicular health and their decline slope over time might look like this. So in their 60s and 70s, you might see a drop off, but generally speaking, they should actually be able to withhold a pretty good testosterone level and not have symptoms.
Right.
For another set of men, what you're going to see is that decline happens much earlier.
Right.
And I would say that because of just not misinformation per se, but just like people are not informed enough.
Yeah.
They don't know to actually look for those signs and actually go and get a test.
Right.
See what's going on here. Because you might be one of the men that have that decline.
Yeah.
But what we can't say on a gross scale that every man goes through something like menopause, because menopause is a sudden drop off from, like, of course there's a period of perimenopause where it jumps up and down, but eventually you go into total ovarian failure where there's no longer any no longer any production of estrogen or progesterone.
Right.
But in a man, that decline is gradual.
Yeah.
And how steep that curve is depends on many things, including lifestyle, all the other things we talked about, but also genetics. And did you have a good in utero environment? So how did your mother, maybe you're lucky, maybe you're unlucky.
Yeah. Okay. And Umahro, with your background in functional medicine, being the wizard of that in the Nordics and probably in Europe, I mean, you've seen some interesting stuff over the years, I'm sure, but going back a little bit to what Anders described there of the sudden decline in some men.
Yeah.
What are some of the things that maybe we're not thinking about that's actually impacting that? We talked about the misconceptions earlier, but like I'm often concerned about things like, and you get bombarded on Instagram with all sorts of things that could kill your testosterone levels. And even some supplements that are known to increase testosterone can actually do the opposite sometimes.
Yeah.
So, I mean, just give me your list of things, whether it's microplastics or ashwagandha or whatever. I mean, how are these things lined up in your head?
Well, I mean, there are some things that are maybe not that strange, but like alcohol.
Oh,
is a big one. But actually, say sometimes gut problems.
Right.
As you said, you had a client who had that gut problem. So I'll just tell you, make it short, but a case. I have actually a friend who started developing high estrogen and low testosterone, but he wasn't obese.
Right.
Because he's actually in the fitness world, and he wasn't, doping either, which could change things. But so what happened? First he got like a mycoplasma pneumonia, so it took 2 months to diagnose, and then he was on antibiotics for 3 months to cure that, and then he got a tooth abscess. So he was like on 7 months out of a year on high dose antibiotics, and it caused gut problems.
Yeah.
And obviously what happens is some of the hormones that your liver will catch and sort of metabolize, they're dumped in your gut. Usually they'll end up in the toilet. So he was having this massive recirculation. So actually he was having recirculation of estrogen.
Wow.
So he was, estrogen he made, thrown out, but came back like a boomerang. And then, because estrogen also is seen by the hypothalamus and pituitary, then the hypothalamus and pituitary were like, well, there's lots of sex hormones, so let's lower production further. So he started actually getting boobs, not beer boobs, but and it all came back. Then when we fixed his gut, changed his dysbiosis, dealt with leaky gut, it gave him some calcium D-glucarate as well, and stopped that recirculation. Then estrogen came down, and his testosterone was normalized because his brain wasn't confused by hormone or steroid hormones getting back in the.
Let me try to get this right for the audience. I mean, you guys are some smart cookies, so there's a lot of terms flying around. Are you saying that in his case, his antibiotics actually was one of the causes for his sudden decline?
Yeah, antibiotics that messed up his digestion, which then meant all the hormones that would normally go into the toilet
were recirculated.
Recirculating, and that completely messed up his system, shut down his own or lowered his own testosterone production, and then the estrogen that he produced at normal levels came back like you get a second, third repeat serving of that. So that's something that I see, and whether it's recirculation or just inflammation from dysbiosis that can shut down production. And then, I mean, obviously all these environmental toxins, and it's probably not a single one, but then when you start combining them, and probably, as you said, then there's genetic differences. So I have someone who genetic is predisposed for a poor, hypothalamus, pituitary, gonadal axis. They have less testicular health, whether that's because of the neuter environment. And then you add in things, because some of these environmental toxins, because they look like steroid hormones, they will increase as HPG. So your body gets confused and says, oh, something came in that looked like a sex steroid hormone. Let me produce some more of the thing in your blood that will latch on to those things, especially testosterone. And then there are some nutrient deficiencies that are quite frequent. Low vitamin D, low magnesium, low zinc.
Right.
That could actually be a major issue as well.
Good list. Yeah. So let's just quickly shift gears again and talk about testing. Because I hear a lot of people saying, just go and buy this finger prick test and I'll do my hormones like Total T or whatever. Yep. What's your opinion on testing? I mean, there's a lot of hormonal clinics popping up in Denmark, just offering testosterone shots, basically. And as I understand it, some of them are very limited in their testing, right? Yeah. Because what the government or the healthcare authorities require us to test is only a few things, right? So what's your take on what's the proper way of testing for imbalances?
I don't believe that the finger prick tests are completely validated yet.
Right.
So this is one of my main concerns with these kind of direct-to-consumer testing, at least in Denmark, because in Denmark, unfortunately, there's no direct-to-consumer, as far as I know, clinics that are providing, you can get here and you can choose any kind of blood testing package that you'd like, and you get it as a venous blood draw. What you can get a lot of places is these kind of small kits where you have to do a finger prick test. Unfortunately, my experience with those is that they either completely overestimate or completely underestimate the situation. and they're not reliable. So the golden standard is venous blood draw from a vein in your arm,
Yep.
and using that we can draw a huge amount of biomarkers,
Right.
Blood testing markers, and then it just depends on how deep do you want to go and how much money do you have to spend on this.
Yeah.
Yeah.
Okay. And what's your opinion on testing, Umahro? I know you're using the DOTS test quite a bit, right?
I use that, but not as a standalone.
Right.
I use that to get an overall picture, but then there are other things I'll want to go
And the
up.
DOTS test for the audience is saliva
and urine.
Yeah.
Saliva and urine, so you get some, both in saliva, urine, total levels of these hormones, and you get some of the metabolites. But
Yeah.
very often, or at least if you get certain sort of scenarios, then you have to go and recheck with a finger stick or venous blood draw.
Yeah.
But I'd say, I mean, if you're going to look at testosterone, you should measure total testosterone, get a measurement of free testosterone, get SHBG.
Yep.
You should definitely also get estrogen levels, DHT as well. You could also get some of the other testosterone metabolites that will tell you more about what's going on, especially if you have issues with acne or male pattern baldness, that sort of thing. And then it would also be sensible to go and have a look at thyroid function, because I've also seen both in men and women, guys who went into early andropause or women in premature menopause because they actually were hypothyroid.
Yeah.
And no one spotted that, and then they were treated with hormones and got somewhat better, but not good enough. So you definitely want to check the thyroid, and then obviously get an idea of stress,
Yeah.
whether that's measurement or just like, do some good validated stress scoring and see how that works. And then also just like sleep. I mean, and because you definitely want to know what's going on, especially if you add testosterone and people already have high estrogen, it's like, well, that's going to push into further estrogen, which will just completely disinhibit or destabilize the whole system.
Yeah,
And sorry if I want to just want a point, Umahro, from our past together with regards to stress testing, right? The importance for men in particular of recognizing and accepting stress, because we've done a lot of testing on subjective stress levels using questionnaires versus objective stress measures in cortisol, saliva based, and so on. And I think it was like 68% of male clients scored that they were not stressed. I mean, me? Nope, I'm not stressed. That's for pussies. I'm not stressed. When you looked at their hormones, significant issues with cortisol, DHEA, and so on. And we didn't measure cortisol or testosterone at the time, but I'm sure if we had, it would have been a picture there too.
Yeah.
So that's a very important point on, a part of the health journey for men, in my opinion, is just, starting to talk with somebody about how you really feel, because it's impacting more than you think.
And I think that goes back to you said that even if we're looking at testosterone, we need to look at this whole hormonal milieu or environment around it, because these things, they're not working on their own.
No.
And so one is off, that's going to impact something else, or sometimes it's a top-down issue. So hypothalamic pituitary dysregulation of everything.
Yes.
Thyroid hormones, stress hormones, sex steroid hormones. And if you don't address that, then it's like, you keep on putting a Band-Aid. Yeah, well, maybe stop skating if you fall on your knees every day in the first place.
Yeah. Awesome, guys. So shifting gears again here in the last 10 minutes, I want to touch a little bit on some of the Instagram noise on how to increase testosterone. Mm-hmm. So I know you're obviously a fan of the medical route, but I know you're also open to the non-medical route, if I can call it that.
Yep.
So what would be your kind of top 3 supplements, let's call it that?
Oh, supplements?
Well,
or just lifestyle aspects?
Either.
Okay. So
I want to touch on
I think
supplements
Umahro,
too,
he already talked about these micronutrient deficiencies. So a lot of men are walking around with suboptimal vitamin D3 levels.
Zinc and those.
Zinc, magnesium, these are pretty important. But what I would say for a lot of men is sleep in particular, because we've done like sleep deprivation studies where you can show a drop-off of approximately 15% in total testosterone by just sleeping like 5-6 hours a night versus 7-8. So this is a small change, but with a big upside. And we talked about stress, obviously. But in terms of biohacks that I've seen that are interesting, I don't have clear data on them, but I know things like cold plunges, they make mechanistic sense, which means that the reason the testicles are outside of the body and not inside the body is because they're temperature sensitive. Mm-hmm. This is both for testosterone production, but also for spermatogenesis, which is the creation of new sperm cells, so for fertility. So that is a very important point, and I think maybe mechanistically there could be a role to play there that cold plunging would be good for your testosterone levels.
Unless you're already totally stressed and it's adding more stress to you.
That is another very good point.
Right. How about you, Umahro? I mean, you must be getting questions left, right, and
Yeah.
center about ashwagandha and
things like
maca and whatever.
Yeah. Well, I mean, a lot of the herbs that are sort of marketed as testosterone boosters, some of them might work in men who have low testosterone, like ashwagandha. If you're stressed, ashwagandha lowers stress levels. So if you're stressed and you get ashwagandha, and biochemically it helps like lower stress signaling, then it will help. But if you aren't stressed and you take ashwagandha, that's not going to be the case. I mean, also all these things, yohimbe, maca, that sort of thing. The only things I've sort of seen okay data on is Tongkat Ali, which might push things in. So men who have normal testosterone, and it might push them a bit more. It's not like take that and you're now going to look like The Rock within 3 months. And also, and this one is really strange, essential oils from blue spruce, blågranolje.
Really?
Okay.
Yeah,
That's
and
interesting.
and so I looked at some of the research, and then I came across it because the guy who started Precision Nutrition, he wrote about it in his own experiences, and then he had lots of the people, and here still with Precision Nutrition, do it, and they measured. They were men who were super healthy in terms of fitness, food, stress, sleep, and they all saw increase of testosterone of like 10, 15, some 20%. Still not outside the physiological range, so that might work. But then I think the other thing is also to make sure that testosterone works inside cells. So vitamin D and zinc, for that. Also vitamin A. If you're low on vitamin A, then the receptors for testosterone won't work. And something that also sometimes works is actually giving people L-carnitine, especially if they have high triglycerides. So it seems like if there are high levels of fats in the cell that haven't been burned, they interfere with testosterone receptors. So if you clear those of carnitine, obviously first thing, change your diet, get in better shape, then you're removing something that literally is like blocking or interfering with the testosterone receptors. And there's also some research in men who, with prostate cancer, where you really drop their testosterone, and if you give them carnitine, because you remove that signaling interference for testosterone, even though they drop their testosterone a lot, they don't get as many side effects that would be related to their low testosterone. So I think that those are some interesting things to look at as well. And obviously just getting like biochemical or getting metabolically healthy. So if you have pre-diabetes, type 2 diabetes, or if you have dyslipidemia, especially high triglycerides, deal with that, and
amazing
things, and signaling will work better even if levels don't change.
So I think we've established that it's not just about injecting testosterone, which is the easy route.
Not that simple.
No. Awesome. So I know we got a few minutes left, and I want to open up maybe for one or two questions from the audience. We got Julian running here with the mic.
Back. I'm going to be really greedy and ask you guys one question, just because I was at a conference last week in Switzerland, the Longevity Investors Conference, and I was sitting on a table with Matt Kaberlein and a few of the big longevity scientists out there. And we got talking about cold plunging and how the body learns how to reduce inflammation naturally. And so when we start doing cold plunging, we're actually getting in the way of that natural process. And so over the long term, actually doing something like cryotherapy or cold plunge could be a deterrent or a negative. Are they right? Am I, because I do a lot of cold plunges, I probably do it most days.
I think so, but I'll let these gentlemen answer that. Umahro, what do you think?
I think, again, it depends entirely on the state of the person in the first place. And I also think it depends on how long, someone in Denmark who winter bathes a couple of times a week, that's not going to get in the way of things. And there's probably also a timing aspect. So this lowering inflammation with cold plunges definitely doesn't make sense for athletes during certain parts of their season. It might be good when they're just having games and bouts and they just need to recover. But I also think, like we say, someone who will cold plunge several times a week, that would long-term interfere with inflammation in a detrimental way. That probably doesn't make sense, because if you look at all these populations who live in cold environments, they're constantly exposed to cold, and it's not like they have inflammatory suppression that causes them to get infections or maladaptive physiology. So I think that's almost like maybe going a bit too far onto the other side of the track.
And is anything else to that?
Yeah, if you're trying to build muscle, I would also say that's a clear sign that you shouldn't do cold plunging just after doing resistance training, because some of the inflammatory cascades that happen inside the muscles, you're going to suppress those with the cold. and that's actually not what you want.
You want to do sauna instead?
Yeah.
Yeah.
Okay, thanks
Good
so
question.
much. Any more questions?
Any questions?
Any questions? Any questions? Going once. Going, wait. There we go.
A brave man.
Love it. Just want to say your name as well.
Hi, my name is William Restrepo. I live here in Copenhagen, but originally from Texas. And both of my parents are physicians, so I grew up with the medical family. I did not go into medicine, but my question for you guys is, with so much knowledge on preventative healthcare, why isn't the medical system, and I'm talking about Denmark because I live here, focuses on all these aspects and doing testing to find out these levels? I grew up where I would get testing, let's be specific, blood testing, vitamin D levels, vitamin levels, all the different things. But I don't feel like it's in the general medical consciousness to do it. And I feel like even more in Denmark compared to the US, they're resistant to this because they say, oh, you're not in an age group that is risk factor for these things.
Right.
So I want to get your take on it, and maybe there'll be a shift in society or in medical health and consciousness to change that. So I'll leave it to you.
I'll do a quick intro and then I'll let you guys answer it. But I think in my experience and having worked a lot in this kind of preventive area here in Denmark the last 5 years, you know, it's actually what you were saying earlier, Anders, that, you know, as specifically when it comes to this topic here, it's not recognized as a disease per se. And we have to respect and be mindful of the fact that our society is built around an education system for doctors and a healthcare system that is meant to treat illness. Now, this is not defined as illness yet. It may be one day, but it's not yet. So I think that's where it starts, that, you know, prevention kind of in our environment doesn't really exist. We're spending far too little money in our, you know, budgets on prevention, which is why there is a growing market for services that we all represent here as clinic kind of directors somehow, right? Anders, what's your take on it?
I think it takes time. That's one of it, and you bring up a very important point, which is that the healthcare system, as it's set up right now, is for the ill. So it's excellent at treating if you have an acute myocardial infarction, you have a heart attack, or you have a stroke in your brain. The system does what it's supposed to. It's excellent. But where it doesn't really help you prevent those issues in the first place. And I think it's a resource problem, and of course it's a philosophy problem, because we as physicians are always trained on the disease model. So we're not trained to look at, you know, what does a incredibly healthy individual look like, and how do we, you know, keep everyone in that state for a long time to prevent them from getting an illness. No, it starts the other way around. You have hundreds of diseases, you learn about different patient populations, and you don't want this person to die within the next couple of years. Well, what are we going to do? We're going to use specific medications for that treatment. And there are many diseases that need that. But it is something that takes time, and I wish it was happening faster. I'm trying to be part of that movement, but I don't think we're quite there yet.
Yeah.
And I'd say the same. It's that we call it a healthcare system, but if you were to be a bit rude, you say it's actually a disease tracking, disease management, disease spotting system. So I think that's the part. And then I think the other challenge is that when studies are done, maybe not specifically for male hormones, but in general of early tracking, what you find is that actually you don't recoup the money, because right here we're at Copenhagen Health Week. We're all people who proactively engage in our own health. But if you go in the general population, that's not to be rude, there's going to be a lot of people who don't really care, or they're not in a situation, they don't have the resources, the understanding. So if you then do early things, say, well, actually your testosterone's already going a bit down, your estrogen is going a bit up, your SHBG is a bit off. For us, it's like when you have Calvin and Hobbes, Steen and Stopper, and you have the teacher going like Martian speaking whatever. And so then, you know, we know it was done for diabetes, type 2 diabetes, but 80% of people are told, we know in 20 years we'll have type 2 diabetes. They just didn't act. So financially, it's like spending that money that early, those resources, actually cost, because most of the people tested were in a situation where they were wanting to act in terms of preventive health.
Yeah.
So that's an issue as well.
Totally agree with both of you, and I want to end it on saying that it's obviously fits right into why we're organizing this health week here, because I think you also, knowing there's a lot of doctors in the room here as well, you know, we as citizens also have to be mindful of what you were saying, Anders, that we cannot expect our doctors to just change overnight in this. We have to respect that it takes a long time, and we have to slowly probe in the right direction. So I think on that, Umahro, Cadogan, Anders, Kaseem, thank you so much. You are amazing guys, and thank you for sharing your knowledge.